Hi guys, welcome back to my podcast. I'm Dawn, I'm a doctor, and today we are talking about does being a doctor change how you think about sex? I think it does. Today I'm going to explain why, and we're going to go through a little bit of, some funny stories along the way. So I hope you enjoy Backseat Positivity. I can't tell if this is because I've gotten older or some of it is from being a doctor, but I definitely see sex as more of like a reproductive function now than I used to. You know, when you're younger, you're kind of like, yay, sex, yay. And then it's like, then you start seeing it as like, okay, sex is to have babies. I think it is probably an age thing. But also, I definitely think the things I've seen, they have changed my view on, what would you even call it? Vaginas and penises. Vulvas and willies. Yeah, we're going to be saying a few crude words, if you call that a crude word, today. Obviously, I mean, we're talking about sex. Like, you can't have a conversation about sex and not talk about... why do I not want to say the word? And not talk about penises. Like, you have to. So, I think, especially having seen a fair amount of pregnant people, and I guess I'm getting to that age where everyone's going to start getting pregnant. One of my friends has had a kid, but most of them haven't, to be honest. I don't know, we're all just waiting until we're like past 30. I am a little bit scared for the time that all my close friends do start having kids. It's like, I don't know, it definitely feels like a new chapter in life. Like, oh, no thanks. Okay, let's get back on to the topic. I kind of still just want to be a kid, I just want to be a bit silly, not like 30. And no, I just don't see myself as a 30-year-old with kids. Okay, I definitely think you change the way you look at all bits and bobs, let's call them. Willies, vaginas, I mean, that's kind of it. But because you see... I mean, the main purpose of me looking at that area is, and I have looked at a lot of those areas, especially in surgery, especially when I've done urology jobs and you see a lot of penises. But most of the time I'm just trying to put a catheter in, so I just don't see it as like necessarily a sexual object. I definitely think that putting a lot of tubes in those areas and in females has changed my perspective on how I sexually see those areas. And it kind of becomes more of, it becomes more of like a task, like trying to get the tube in. Obviously you don't see it as a sexual thing, like, not at all, not in any way, shape or form. I mean, some people might, but not me. But I also think, because I've seen so many, that I've seen so many shapes and sizes, that to me, I definitely think this has been a positive thing. Kind of nothing is abnormal, I've seen, I mean, do I need to describe them? Probably need is a strong word, but I could. I mean, you can kind of get the point, right? I've seen circumcised ones, I've seen non-circumcised ones, I've seen non-existent buried penises with very large men. I've seen... It's rare that I see like a young person. They're usually old. However, I have seen young ones. And it's also rare that I see an erect one. They're usually flaccid, obviously. And yeah, usually old, flaccid men. Vaginas, I've seen less of those. They tend to just go to obs and gynae rather than come to surgery, but you still do get issues. I've probably seen more female bottoms than I have front bottoms. I think I've seen more front bottom in A&E because they haven't yet seen gynae. Or sometimes you're on a medical outlier ward and you have to see the patient first and then you refer them to gynecology. So yeah, you have seen, I mean, obviously I've seen like the front bit, but not necessarily been like, inside or whatever. But also when I was on GP for like 8 months, because I'm female, a lot of the females liked or preferred a female. So as a result, I would see a lot of female patients. Saw my first, I've seen herpes. That looks very painful. I haven't seen chlamydia or gonorrhea though. I've seen patients with HIV, I've seen patients with warts. Yeah, herpes. No syphilis that I know of. Probably, yeah, but the most common things I've seen that area for are urinary retention or catheter issues, usually. Otherwise, don't really delve into that region, especially not doing obs and gynae. Now, yeah, so nothing is really abnormal. I've also seen, old people are quite wrinkly. And as a result, the stereotype of them having saggy bottoms and saggy balls is kind of true, I'm afraid. Sad to say. Is it is it sad to say? It's sad to say in terms of, I don't know, I'm not breaking anyone's dreams, I hope. But I think there's definitely some creepier bits that I've seen of their sexual organs that I kind of wish I didn't know. Now, I don't think I've ever done any dissections of that area. And when I saw an autopsy, it was a man, and you don't go to that region, really. They are naked, but you tend to just focus on the organs, and sexual reproductive organs aren't really that, usually they don't result in deaths, unexpected deaths. So, I have also, I think as a female this probably bothers me less, but maybe as a male it probably would bother you, but I've seen a lot of trauma to the penis. A lot of people putting things up, or I've seen vagina ones too. A lot of people put things in their vagina, especially like razor blades or glass is a common one. Obviously that's not done for sexual pleasure, that's usually done for self-harm reasons, but I don't really go anywhere like near that. That's like they go into surgery usually for that thing, or they see obs and gynae. But the male ones that I've seen, I've seen some quite traumatic catheters either being pulled out, or I've seen some phimosis or paraphimosis, I always forget which way around it is, but where the foreskin gets stuck and then the head swells up. So I've seen it all. Now the few things that I haven't seen actually, which is probably the most common thing doctors get asked, is things up bums. Now I don't know if they keep it discreet, they might do, but I also haven't done like loads and loads of A&E work, and if I have, it's kind of, I've seen it's not that common that those kind of things come in, but it's always sort of known about when it does, or told retrospectively. So some of the ones that I've heard have been like oranges, but the problem is with putting things up your bum is it just like disappears because it's like a vacuum. And then an orange is very hard to get out, so I think they had to thankfully an orange you can chop into bits, so I think that's what they did. But anyway, I think the point is that I'm very open about these things as a result of being a doctor, but you also might see sexual stuff as a bit less sexual because it's like, oh, I've seen it in some real states, some real different situations, and you kind of see it more as like a body part rather than a sexual object. Probably for the better. Okay, a couple of the creepier things that I've noted throughout my career. One in particular really grosses me out. In fact, I'll tell you the other one first. That one is that I've seen a lot of cross-section penis shots, and you kind of don't really think about the inside of a penis until you've seen it and studied the anatomy of it many, many times. And then the problem is I'm a very visual person. So in my head I can see all of those things. I think I've mentioned it before with, it's really dark in here. Is the light, should I turn the light on? No, that looks bad. I think it looks okay. On the screen it looks okay, but it feels very dark in here. So it's like a weird like boudoir setting. It feels a bit odd now because it's dark and I'm in bed talking about penises and vaginas. Like it feels weird. Not weird. It feels more weird than it did when I started. Okay. So yeah, a lot of cross-sectional penis shots, and I have talked about it in the past, with pregnancies, I don't see it as a bump, I see it as a human. Like I can see the whole body in there in my mind, because as a very visual person, I see the inside. That's just how my mind works. The other thing I didn't know until probably I was like 18 or 19 that vaginas are like corrugated inside, and I don't really know why. But that really grosses me out, like a lot. A lot. Like I don't want to go up there. I don't mind with gloves on because then you can't really feel it. But no, it really, there's some things that like freak you out. That is one of them. There are organs that I don't mind touching, In fact, they feel quite smooth. I like smooth. Smooth texture is good. Corrugated, no, not my vibe. So those are my creepy bits. Strange sentence. Now let's move on to the stories. I feel like this is going to be a shorter episode than I thought. Oh, I just bent my hand back. That really hurt. Oh. So, I've never actually caught anybody having sex in hospital, but I know people that have, and weirdly the stories that I've heard are that people have sex like right after giving birth, which I think is amazing in like an outstanding way, and a wow, and also like a what are you doing? Could you not wait till you got home? But also like how do you go through that and then the same day you're having sex? And I think it was a vaginal birth as well, like it wasn't a C-section. I even clarified that. So the only time I've ever caught anything a little bit funky going on is like I had a patient who was just a bit like wild, let's say. Her and her boyfriend, like when her boyfriend came to visit, they would like lie in bed together, which seems normal, but it's like just not done in a hospital bed. It's like if an old person's wife came over and like start and like lay down in the bed next to them, it just doesn't like, it feels a bit weird. It's just not something you see. But I was like, okay, fine, you're just watching Netflix, I can cope with that. If anything more wild happens, then come on girl, we gotta sort that one out. I think the only time I've seen anything a bit like that, so the thing that happens quite often in hospitals is, well, not often, but more often than you'd imagine, is old men usually with dementia, tend to masturbate. I have rarely, if ever, seen a female do this, but yeah, it's often men will do it. Rarely anything comes of it, but unfortunately, often they do it without the sheets on, and then it's a whole show for the whole bay. So that's more of a behavioural thing, but it's, you know, something that you don't particularly fancy seeing. Let's put it that way. I'll probably get like, I don't know. I've told this story before. It's not a good story, but it's not great, but it's not like I'm a bad person because of it. But I have actually talked about this in one of my other podcast episodes, and I couldn't remember which one it was, but I'll let you guys go and find out what that one was. It was one from when I was talking about my doctor day. Is the time when I gave a patient an accidental erection. I'll let you go and find that one. I don't need to go through it again, but it was an accident. Sometimes these things happen. It's like one of the things you get taught in med school, like what do you do when you accidentally give a patient an erection? And I talk about what I did. So yeah, go find it. It's a good story. And I'll tell you my weird thoughts for the day, and it's very sex related, okay? Not only do I not like corrugated vaginas, but I also don't, it's not that I don't like it, but I think it's weird, hence the name, weird thoughts. When I'm with you, all I get is weird thoughts. Okay, weird thoughts is, think about a penis and think that is another part of a human, and then it goes inside of, if you're female, or you know, maybe even male actually, it goes inside of you and then like injects some fluid. Like, I think I'm thinking too much about it, I know that, but I think about these things again in a very visual manner, unfortunately for me. But it's literally like another human body part inside of another human, just another human in general. And I find that a bit weird. Like, it's just maybe something that you shouldn't overthink. But I do overthink these things, so sorry. Now, did you know that one of the most common reasons, I believe, for doctors getting struck off, obviously, especially male doctors I'm talking about, is because they have sex with their patients, and they usually have sex with them and then, you know, form a relationship with them, I believe. I don't know, but that is one of the common reasons. It's not that, you know, people can forgive malpractice to some extent, and it can be, you know, what went wrong, let's fix it, but you've gone out of your way to sleep with a patient, you knew that was wrong, like, you knew what you were jeopardizing. It's kind of it's not like 3 strikes and you're out, it's like 1 strike and you're out. So it's a more common reason. I mean, all of this is available on the internet. If you look up on the GMC website, you can see whether doctors have been struck off or not, and why they've been struck off as well. So you can find this out. So I'm not like divulging confidential information here. It's public information, but I don't think people know it. And why would you know it? I guess, unless you'd known someone who was in that situation. Let's finish off with a great story. Now, I have no sexual inclination to females whatsoever. Like, I just doesn't do it for me. I don't know why I started with that preface. I don't know how you say it, but I don't know why I started with that. But it must have been much more awkward for the men involved, okay? Because what year were we? 3rd or 4th year, I think. As a 3rd or 4th year, we had these 2 nurses. They were very, very lovely, don't get me wrong. But it was a fairly weird session. Now, they allowed us to do what we call a bimanual examination on them, which is basically, it means 2-handed examination, and you use 2 hands, one inside of the vagina, not a whole hand, like a finger or 2, but 2 fingers inside the vagina and then 1 finger on the abdomen. And it's a very weird situation because they are not only your teachers, but they're also, could be your colleagues, but then you're like 20, and it's a bizarre situation to be in. It was a really good learning experience because you get to practice and someone's like, yeah, that feels okay, like you're not being like, sounds a bit weird, but you're not being like too aggressive or it's not hurting or whatever, whereas a patient just wouldn't necessarily tell you that. So fair play to them. I am not knocking them down whatsoever. I think it's great. But as a concept, it is a very strange one. Now, I think it was a bit more awkward for the men, arguably boys, in that situation, because we were like 20. I feel like you're quite young when you're 20. But one of the weird situations for me was when I had my fingers inside of this lady, and I'm like asking her a question. I'm like, oh, is this like the right place? And then she's like, oh yeah, left a bit, right a bit. And then she starts having a conversation with me, and I can't, like, I've never done this examination before, like on a person, so I can't multitask. And I'm like, do I stop and listen, which I choose to do, or do I carry on and just carry on, like, multitask and like do the examination and talk to her? But it's not like I couldn't do that, it's just that I'd already stopped. So then it felt weird to just like carry on when she was talking about that one specific part of the examination. So I stopped, and then I was like, do I take my fingers out? But then I'm going to have to put them back in. Or do I leave them there, not knowing how long this conversation is going to go on for? It was a weird dilemma to be in. Like I said, I opted for the fingers remain option, and the conversation probably went on for like 30 seconds, which, when you've got your fingers in a woman's vagina, does feel like quite a long time when you don't want your fingers to be there. Anyway, on that bombshell, I think, like I said, in summary, I think it does change the way you think about sex, but I think it kind of normalises everything. You kind of realise that everyone's a bit different, and that's fine. I don't necessarily think it's like a bad thing. But I definitely think it makes you see the more functional aspect of human life and reproductive life, but also it makes you feel better about probably yourself and other people as well. Like, people, you're like, oh, is this normal? Oh, is this normal? Yeah, it is, because everyone's normal, just in their own little special way. There are lots of variations, trust me. and obviously there's themes, but no one is the same. And on that positive note, I have to go pick up my car from the garage, so I hope you enjoyed that episode. It's a fairly short one, only half an hour, but it's all good. Obviously, if you did like it, then give it a like if you're on YouTube. That would really help and help me get better content to you guys. Get some guests on, maybe even in the bed. And maybe that's my new thing. I just interview people whilst we're in bed. That would not be a bad podcast. In fact, it would be a great podcast. It would be bed seat positivity instead of backseat positivity. Yeah, it would help me probably get guests on and help me get the content to more people. Let your friends know if you liked it. Give it a review if you're listening on the podcast. Just, yeah, if you help the podcast will help you. Ooh, what a phrase. But yeah, helping the podcast get to more people, and by liking and subscribing and following or whatever, it's not just because I want more followers, it's because it does actually help. So yeah, and it helps me get better content to you. So anyway, thanks so much for listening and watching, guys. I will see you next week. By the way, I upload twice a week, Mondays and Thursdays, so follow to not miss an episode. Bye.